আমার নাম হেনা মাহবুব। আমি বাংলাদেশ থেকে আসছি আমার ফুপ্পিকে নিয়ে। ওনার বাংলাদেশে অনেক প্রবলেম ছিল, ওইখানে আমি নিজে ওনাকে ডাক্তার দেখাইছি, বাট কোনো ইমপ্রুভমেন্ট পাচ্ছিলাম না। দেন আমি এখানে আজম ভাইয়ের সাথে আমার একটা প্রিভিয়াস পরিচিতি ছিল, ওইটার মাধ্যমে আমি এখানে ব্যাঙ্গালোরে অ্যাপোলো হসপিটালে আসছি। আসার পর আজম ভাই আমাকে সুন্দর নার্সিমান স্যারের ওখানে নিয়ে যায়।
This patient, Meena Mehboob, 48 years, who came from Bangladesh, has been having a neurological pain which is in the back of the neck, back of the chest, and as well as the shoulders and the upper limb, which has been going on for the last 15 years. And she has been to so many doctors, and unfortunately she got no relief. Finally she came up to me, and when I saw her in the Apollo hospital, my first suspicion was whether am I dealing with a thoracic outlet syndrome, and immediately I examined her. Her circulation was normal in the upper limbs, but she had some sensory deficits and in the upper limb, and she had some tender points in the neck. Then immediately got an X-ray done, which showed that she had complete cervical rib on the left side and incomplete cervical rib with the fibrous cord on the right side. And immediately I counseled her, and there are various important structures in the neck surrounding the cervical rib, which are brachial plexus, which is supplying the both upper limbs and which is important for the motor function. And also there are nerves like phrenic nerve, which supplies the diaphragm, and also the nerve to serratus anteriors, which is in the back of the chest wall. So all these nerves have to be carefully identified and protected during the operation, and make sure that the rib is removed and the fibrous structure is removed. And also we have to remove part of the scalenus muscle in order to give more space for the brachial plexus. This is exactly what was done in her, and we did the operation on our both sides, and finally we were able to achieve good results, and the complete rib was removed on both sides, and immediately following surgery her symptoms resolved, and she started feeling good, and her motor function was completely all right in both upper limbs, and she had no muscle weakness, and she had no neurological symptoms following surgery. So we have had a good outcome in this patient, and this is what happens when you do a perfect surgery. And this surgery is one of the complex surgeries, and it is done in very few centers in our country, and we are fortunate that we are one such center in our country. We could do this procedure. Thank you.
আজম ভাই আমাকে অ্যাপোলো হাসপাতালে নিয়ে আসছে, আইনা সুন্দর স্যারকে দেখাইছে। তার ট্রিটমেন্টে আমি অনেকটা ভালো। ওনার ট্রিটমেন্টে আমার ফুপ্পি খুব ভালো একটা রেজাল্ট পাইছে। সার্জারিটাতে খুব ভালো ইমপ্রুভমেন্ট হয়েছে, খুব তাড়াতাড়ি রিকভার হয়েছে ওনার। তো অপারেশনের পরে ওনার অবস্থাও খুব ভালো, অনেকটা ইমপ্রুভমেন্ট হয়েছে ওনার ফিজিক্যালি। উনি এখন আগের থেকে অনেক ভালো ইমপ্রুভমেন্ট করছে, আর এখন আমরা ওনাকে নিয়ে আবার বাংলাদেশে মুভ করতেছি। Thank you, Dr. Sunder and thank you, Apollo Hospital.